Unfortunately, we have had 9 deaths to date, and we now report 1 person critically ill. Therefore, there are currently 309 active cases. At this point in the progression of the epidemic, measure than the total number of confirmed cases. I want to bring some graphs to your attention. The first graph displayed shows the acceleration in our recoveries, the green line, and you can see that it has been rising pretty fast over the last 2 weeks. And you will also see the reduction in the number of active cases, the blue line. And that is a good sign in terms of the progression and management of the epidemic. Our recovery rate is now at 44%. The second graph shows how our actual cases track against various doubling curves, starting from the point when we had our first 100 cases. The doubling curves show you various scenarios of how rapidly the numbers could increase. So if you were on the 6-day doubling curve, then that means that 6 days from any point, your numbers would be doubling. And that is a faster rate of doubling than if you were on the 8-day doubling curve, which would be the green line, or if you were on the 10-day doubling curve, or the 12-day doubling curve, or the 18-day doubling curve. So when we had our first spike, we were on a 6-day doubling curve. Then we moved to track an 8-day doubling curve. And then when we finally got on top of that workplace outbreak and started to control that, then we saw our curve flatten, and then we moved across to intersect with a 10-day doubling, a 12-day, saw our curve flatten, and then we moved across to intersect with a 10-day doubling, a 12-day doubling, and now we're moving right across. If we continue on this path, we will intersect with the 18-day doubling, and we keep our numbers low, we will do even better, moving on to possibly 35-day doubling. But right now, we're about to cross the 18-day doubling. And what that tells you is that your potential rate of increase is reducing. Of course, the solid black line, if we could go back to that graph, is the cumulative number to date, 564 cases. And the dotted line shows what our numbers would be if we did not have the spike due to the workplace cluster. The last graph that I want to display shows the reproductive rate, or as it is called in epidemiological circles, the R0. The R0 is a measure of the average number of new infections that arise from a single case. And the graphic on your screen shows one person in red, which would be your index case, the person who is infected. And on average, the SAR CoV-2 virus has an infection rate of somewhere between 2.2 and 3.5. So this graphic is showing that one person could potentially infect 2, and then those 2 persons go on to infect 4, and those 4 go on to infect 8, and then it continues to multiply. What we are interested in is how do we reduce the rate of spread, and the measures that we can put in place to ensure that one infected person infects 1 person or less. And the measures that can do that are social distancing, hand sanitizing, wearing your masks in public places if you have to treat with persons who are ill. And if you are ill with respiratory symptoms or flu-like symptoms, stay at home. If you know that you have a weak immune system, you are ill, you have comorbidities, diabetes, hypertension, exercise a greater level of caution. Measures such as observing the curfew, limiting your travel and your actions. Those measures which are effective public health infection control measures, but also just you as a person taking responsibility for your own health. That will help in reducing the infection rate of the disease. So presently, our infection rate, our R0, the reproductive rate of the virus in Jamaica, is estimated, our most recent estimate, to be about 0.8. Effectively, you could say that one infected person infects one other person on average. So it is not the best place to be. We want it to be significantly below 1. Transmission of the disease is still taking place, but by virtue of the effectiveness of the measures employed, we are bringing down that rate. You will recall that at one point we were as high as 2.2, and then we've come down to 1.6, and now we are at 0.8. But this is not cause for celebration. It is not cause for complacency. This is now the time when we must continue to faithfully observe the measures. I've said repeatedly from the beginning of the epidemic that our response has to be measured and proportionate, evidence-based, and situationally appropriate. As a result of the evidence, that is the trending down in active cases and our reduced R0, we have gradually been relaxing some of our control measures. Please note, however, that if our numbers start to rise significantly, we will tighten up again. And I think I need to repeat that point. If our numbers change for any reason, people stop observing the curfew measures, for example. People start to gather in groups of more than 10. People who are ill deciding that they are not staying home. All these behaviors could contribute to an increase in our numbers. So I use the opportunity to make the appeal. Yes, we're doing well, but don't let our success become our enemy. Continue to faithfully follow the measures until we can declare this pandemic as being over. I want the public to clearly understand that our measures will continue to be guided by the evidence and the numbers. So as we relax the measures and we increase the rate of repatriation of Jamaicans, even with the best will and the best implementation of the measures, we recognize that because of our limited resources and the constraint that places on our ability, that there is the possibility that our numbers could rise. So we have increased the rate at which we are repatriating our Jamaican brothers and sisters. But even with the best will in the world, even with the best organization, even when we put in the best public health measures, the possibility is not just for Jamaica alone. We have seen it in other countries right across the globe, that when repatriation of nationals take place, there is the likelihood of our numbers increasing. At the same time, I'm pleased to report that the disembarkation of over 1,024 ship workers from the Royal Caribbean cruise ship, the Adventure of the Seas, was successfully completed yesterday afternoon at the Falmouth Pier. This brings to just under 1,500 Jamaicans being returned to date using the controlled reentry program. At present, 19 Jamaicans from the Royal Caribbean vessel have been placed in isolation, having been tested positive for COVID-19, while 624 persons have been released into home quarantine following their negative results. 2 more cruise ships from the Norwegian Cruise Line with 174 Jamaican crew members, and the Carnival Cruise Line with 240 Jamaican crew members are currently docked in Falmouth. A Disney Cruise Line vessel is also tentatively slated to berth on May 29th with more than 400 Jamaican crew members. The Carnival ship also has 180 Colombian nationals who will be transported via a secured corridor to a waiting charter flight at the Sangster International Airport to be flown back to Colombia. It should be noted that this is not the first time that Jamaica has facilitated airlift of crew members or passengers. I believe we did it early in the start of the epidemic, and it is part of our international duty. The same protocols and procedures used for the Royal Caribbean Cruise Line will be used to land our incoming ship workers. In addition, approximately 220 Jamaicans, including 40 involuntarily returned Jamaicans, are scheduled to return by air over the next 7 days. Last week, I had indicated that we were in the advanced stages of developing a home quarantine monitoring solution through the Jam COVID-19 app. This solution is now fully operational and is being used to monitor persons from the Royal Caribbean cruise ship who are in home quarantine. There are some persons who are having difficulties tracking due to internet connectivity issues and who are being monitored via phone calls and periodic visits through the command center that has been established at the JCF. I must take this opportunity to thank the Amber Group again for developing this solution for us to be able to deploy it in record time. I want to also take this opportunity to thank all the workers, the doctors, the nurses, the public health officials, our security forces, the personnel from the Port Authority and the Falmouth Pier, all the persons who are involved in the JUTC, yes, in ensuring, and the hotel and their staff, the Grand Bahia Principe Hotel and their staff, for making this exercise a seamless one and one in which all Jamaicans can be proud. You know, there's been a lot said by persons bent on finding entry and relevance into the operations and the conversation. And for deliberate reasons, we have decided not to distract ourselves in responding to every claim that is made. I wish to repeat that the government of Jamaica engaged the cruise ships. It is a very complex operation, and by virtue of that complexity, it would not be appropriate for the government to give information that was premature. Those persons who are knowledgeable about these kinds of issues, managing disasters and these kinds of crises, will know that the situation changes minutely. 1 minute you're told we have X number of workers on the ship, and then another minute you're told, wait a minute, we're going to consolidate with a ship somewhere else. 1 minute you're told we're coming in on X day. And then all kinds of things happen, weather, logistics issues, and you get another date. So when we are asked about these issues in Parliament, our standard answer was, we are in negotiations, but as I've said in Parliament, we do not disclose these things until we are certain and they are finalized. I take the opportunity to assure all Jamaicans that the government is working to put in place all the measures, not just for ship workers, but also for the almost 8,000 Jamaicans who are registered waiting to come home. The logistics of getting them home safely is even more complicated than that of the ships, because at least you have certain knowledge of a vessel that will take them in. To deal with the persons who have to come by aircraft, as you know, we don't have standard regular flights now, so we have to wait on flights of opportunity. We are also working very hard behind the scenes to ensure that we can put things in place to ensure that flights with some regularity are available to repatriate our Jamaicans. And those discussions have to happen at the highest level. They have to happen with great sensitivity, because you have issues, for example, is it economical to fly? Are you going to be flying one way, meaning you're bringing in passengers but going back without? So the economics of the flight has to be sorted out. And then, you know, just the whole business of ensuring that people who say they are going to register to come, that they do actually turn up for the flights, and that you don't have empty seats that could have gone to persons who want to come. So the behind the scenes management of these issues are very complex, they are resource intense, and it requires the government to manage it in such a way as to ensure the safety of the persons coming back, the public safety of Jamaicans here, the safety of the travel, and to ensure that we, as much as possible, minimize the cost. We're now deploying the same protocols and logistics that we utilized for the Royal Caribbean ship more broadly to facilitate the return of the over 8,000 Jamaicans who have applied to return on the COVID system. What this means is that the state quarantine that we had in place, which we had required for 14 days, we will no longer require that 14-day state quarantine. Persons will arrive in Jamaica, they will be tested, they will be facilitated at a state quarantine until their tests are ready. If their tests are negative, then they will be allowed to complete their quarantine at home. This will allow us to increase the rate and pace at which we can safely repatriate Jamaicans overseas who will be relying on air travel to get home. Suitability of homes and living conditions have to be assessed for home quarantine. To speed up the assessment, we have sent out a series of questions for applicants on the COVID system to complete. I urge everyone who has applied to complete and submit this as soon as possible so that we can continue with processing your applications. Notwithstanding our focus on the ship workers presently, we will continue to work assiduously to focus all our resources to repatriating Jamaicans by air. And from the last assessment that I have received, we are expecting that we should be able to complete the repatriation of Jamaicans by ship by the latest, the middle of the first week of June, in June. And then thereafter, we should have our full energy and resources to focus on increasing the pace of the repatriation of Jamaicans coming in by air. But it should be noted that even though we are focusing on the ships that have come in to repatriate them, we are still bringing in roughly in the next 7 days, approximately 220 Jamaicans by air. So we are doing both. But by mid of the first week of June, we should be able to exclusively focus our attention on repatriating as many Jamaicans by air as possible. As indicated last week, the current work from home orders will expire at the end of May. As of June 1, persons other than our vulnerable population, that is, persons aged 65 and over, and persons with comorbidities, will be allowed to return to work. The PSOJ has been working with the health authorities, and we are well advanced with developing the infection prevention and safety protocols that would be needed for the workplace. I've heard the concerns of certain groups from certain quarters, and I want to take this opportunity to clarify the government's intent in allowing the work from home orders to expire. We're not saying that everyone should return to work regardless of their circumstances. We acknowledge that there are persons who would have responsibilities by virtue of schools being closed and having children at home to attend to. We acknowledge, and we have said, that there are persons with comorbidities who should be very careful how they return to work. And therefore, we expect that the employers would exercise a high level of understanding in this period. But we also have the obligation, the duty to return our economy to its full productive capacity as quickly as possible. So our theme, our new theme, is work safe and work smart. So work that does not need physical presence at the workplace. We are encouraging our employers to dialogue with their employees, negotiate with their employees, use the facilities that are available under the flexible work arrangement legislation to put in place the framework, the measures, the systems, the solutions that will ensure that persons who have children at home, by virtue of school being out, persons who are ill, if they can be facilitated with these measures, let us use them. We have had this law for the last 6 years. It hasn't been fully utilized. Let us utilize it now. There is a sense as well that the government is moving too quickly to reopen the economy. And I want to address this point briefly. The Jamaican government has been very careful not to shut down the economy. Somehow, in the crescendo of opinions, we forget that there was an overwhelming call from certain quarters to shut down the economy. I mean, it's as if those calls were not made. The government did not respond to that. The government outlined a process that if cases reached a certain level and it became situationally appropriate, then we would still act, but with measure. And you would have seen that where it the government utilized community quarantine. We had lockdown of one parish, and we contained workplace clusters. But we never shut down the entire economy. We took measures to control our borders, and we have been doing that from the start. From even before the first case came to Jamaica, we put in place travel restrictions, and we gradually tighten those restrictions till we reach the point of closing the borders to incoming passenger traffic. And now we are at the point where we have to now change those restrictions to allow for the full operation of our economy. How is this going to be done? We do not intend to do this without giving notice. We don't intend to do this without developing the protocols to do so. And we don't intend to do this without having the public health science behind what we are doing, justifying the actions. And as I have said before, the evidence before us, looking at the number of cases that we have, the number of cases that are still active, looking at the number of deaths that have resulted, looking at the number of recoveries, looking at the infection rate, and looking at the level of citizen cooperation, which is, in my opinion, probably the most important variable. How are the citizens behaving? Are they acting responsibly? And I think I would, if I were to give a grade, I would say that 70% of Jamaicans are acting responsibly. The greatest challenge I'm seeing is for us to observe social distancing. And that's the hard part. And I take the opportunity to appeal. in public places, in meetings, in gatherings, stay 6 feet apart. Try to get the concept of 6 feet. Walk with your tape measure if you have to, and get that concept of 6 feet. But that is the critical thing. From my estimation, the Jamaican citizens have been acting in a responsible way generally. The challenge that we face now, as we move to reintegrate our returning population, is for them to act with an even higher level of responsibility as they are reintegrated into the society. So many of them would be coming from other countries where similar requirements and measures and protocols are in place, but could feel a sense of relaxation coming home and do not observe with the faithfulness that is necessary to preserve the good management of the epidemic in Jamaica. So I also take this opportunity to appeal to those Jamaicans returning home that you have a duty to follow the rules, the protocols, the measures in place, and to follow them faithfully and consistently. So, in returning the economy to full capacity, it will require us reopening our borders at some time. We can't continue to isolate ourselves from the rest of the world. So the debate will ensue, I'm sure, about whether or not it is time or we should wait. I wish to remind persons that we don't want to survive the pandemic and die in the recession. So we have to manage both things. We have to manage the epidemic and ensure that we do not have an extended recession. How well we manage the epidemic will also help us in managing the recession. So as we make gains with the epidemic, and these gains, we want them to be sustainable gains in people behavior, we then use that as much as possible to increase our productivity. Get people back to work, get them back to work with the mentality of working safer and working smarter. Repatriate our Jamaicans who are overseas. Get them to come back in a safe way and get them to respect faithfully and consistently the measures that are in place. And if we open up, when we open up and we get visitors in for tourism, visitors in for business, we have to ensure that we have a strong monitoring mechanism, a strong policing mechanism, and a strong public education mechanism, in addition to, as I said earlier, monitoring, but increased surveillance of the spread of the disease right throughout the country. So we're putting in place these measures. We're studying it very carefully. I believe we're very close to that point now to settle all the protocols and all the measures. Because, as I've said earlier, at the end of the day, we want to survive the epidemic, and we also want to survive the recession. So, ladies and gentlemen, I think I've poured out my soul to you today. There are some other matters which Minister Tufton and Minister Mackenzie may want to bring to your attention. Yes, there was a case of a young person, a young male, I believe it is, Minister Tufton, a young male who is a worker at the infirmary in St. Anne. And I wish to point out, to Minister Mackenzie's credit and to Minister Tufton's credit, that this was not a case that happened upon us. Minister Mackenzie and Minister Tufton put in place a protocol to test all the workers in our infirmaries right across Jamaica. And it was out of that surveillance that we picked up this case and have put in place all the measures which will be outlined shortly. So I'm going to invite Minister Tufton to give you an update.
Thank you, Prime Minister, except that I need my glasses. Much better, thank you very much. So the part of the way forward, Prime Minister, as outlined by you, is to ensure that living with COVID, as we should expect to do, with the opening up of the economy, with the less restrictions on movement, would be for us to look at the vulnerable communities across Jamaica and to ensure that we prepare ourselves to provide information in the first instance to promote prevention, and in the second instance to treat to the extent that the COVID virus touches down in any of those vulnerable communities. Two such vulnerable communities would be infirmaries and nursing homes. And there are others, the prisons, communities that have high levels of poverty where basic amenities may be absent. Of course, persons with underlying conditions, so diabetes, hypertension, etc. So the Ministry of Health and Wellness, working with all our stakeholders, and in this case with local government, is going through a process of assessing those vulnerable communities and putting the necessary infrastructure in place, both personnel capacity, testing, monitoring, to manage that process under the living with COVID or freeing up of the society and economy. In that case, the infirmaries have been a key target, and as you said, Prime Minister, Minister Mackenzie and I have been working closely with the health team, of course, and members of local government to put some systems in place. So we do have a case, as reported in the media and confirmed by you a short while ago, of a positive employee at the St. Anne Infirmary. The individual is male, is currently asymptomatic, and has been put into isolation in a government facility. Since that discovery, contact tracing has commenced and 21 close contacts identified and placed under home quarantine. They include 12 high-risk members of staff, all of whom have been sampled. Up to yesterday, May 25th, all 80 permanent staff members and 5 visiting staff members were sampled for COVID-19, and all 106 residents have been tested. Of note is that testing at the island's infirmaries was initiated, as said earlier, as part of this overall strategy, and this will continue. We have so far tested 6 of 14 infirmaries island-wide, so the process continues, and we're expecting to get the results of the samples that have been taken within the next couple of days, and we will update the country on this. Just quickly, in terms of nursing homes and an update around nursing homes, another vulnerable community, the ministry has now assembled the inspection team for the island's nursing homes. Since March 2020, 118 nursing homes have been inspected together with 3 hospitals. 85 of the nursing homes have returned satisfactory results, 33 not satisfactory. We are currently awaiting information from 13 additional facilities. A detailed status report will be provided to the country in terms of the nursing homes. But let me just say that whether these nursing homes are registered or unregistered, the decision has been to inspect all and to provide a COVID protocol in these facilities to ensure that we minimize the risk as part of the way going forward. More will be said on that in due course. Thank you.
me invite Minister Mackenzie to give a quick brief on the other measures.
Thank you, Prime Minister. As Minister Tufton outlined a while ago, the protocols that we have put in place in our infirmaries and golden age homes across the country. Let me say that since the announcement was made early in the response to COVID-19, we had restricted visits and intake into our infirmaries. Those measures still stand. The government committed to provide resources to all the municipalities to establish isolation units within each infirmary. Let me dispense whatever mischief is being made in regards to that, and to advise the country that all our infirmaries have up and running isolation units. That was done over the last couple of weeks. We continue the testing protocols by doing the temperature checks. The question has been raised about personal protective gears within the infirmary. Let me again state for the record and dismiss any mischief that is being made that all infirmaries and golden age home have adequate personal protective gear for workers, and the workers have been using those gears accordingly. Concerns have been raised about the operations of our infirmaries. Again, let me dispense the rumor and the mischief that is being made. That sanitization program was undertaken a couple of weeks ago, and another round has been conducted. The infirmaries were provided with 150 temporary staff to support its operation, and that process is still in place. One of the initiatives that we intend to put in place to ensure that we beef up the safety of the infirmaries is that we are now going to be providing transportation for each infirmary worker to take them from home to work and back. So we are going to be reducing the contact that these workers have with the general public in order to protect this population. The government is committed in maintaining the structure that has been put in place, and we can assure the country that all the steps that are necessary to protect the vulnerable in these institutions have been taken by the government, and we have not dropped the ball on protecting those within our infirmaries and golden age homes.
Thank you, Minister. And I just take the opportunity to remind Jamaicans that as part of the relaxation of measures, the new curfew hours will take effect. So instead of 8 p.m., the curfew hours begin at 9 p.m. Minister Mackenzie, you forgot to give an update on the bars.
Thank you, Prime Minister. Prime Minister, I must say that we are pleased with the response from the the operators of bars across the country. We have sampled since the period that the order was lifted, more than 2,500 bars have been inspected. And we are seeing where the general acceptance of the guidelines that has been laid out, Prime Minister, have been met. We have seen where, especially in the corporate area, there's a very high percentage of compliance with operators taking the necessary steps to ensure in the areas such as where there are no stools, benches, chairs, or tables. We have seen a high of over 60% in those areas, where we have asked where gaming operations in terms of machines are placed in areas where social distancing can be practiced. That is one area, Prime Minister, that we are not happy about, because we are only enjoying over 30% compliance in that area. In terms of putting in the necessary facilities, we see where the bartenders are wearing masks. I have over 70%. The presence of washing areas and sanitization for persons attending the bar, over 70%. We're seeing where the observing of the curfew hours is extremely high. Over 90% of the operations are complying with that order. And surprisingly, Prime Minister and colleagues, in the area of 5 persons, including the bartender, based on the survey that we have done, over 80% compliance in that area, and that is one area that we are very pleased. We are also observing the same discipline within the areas of the dominoes and other games, where the compliance is relatively good. Prime Minister, one of what we have found in the exercise that we have been undertaking is that a significant number of these bars are operating without the requisite permits, spirit license, food anglers permit, trade license, etc., is wanting. But a protocol is being worked out between the Ministry of Local Government and the Ministry of Justice to ensure that we work with these operators to comply fully. And the last thing, Prime Minister, this survey that is being conducted on over 11,000 bars, village bars and taverns across the country, is not the final decision. We are doing an exercise that will determine, but the final decision is that of the Ministry of Health, and they have been working closely with us to ensure that we do the survey. So we are expecting that by the end of the 14 days, we would have surveyed almost the majority of those bars that are open and are operating. But overall, we are seeing a positive response from the wider public on this matter, Prime Minister.
Thank you, Minister Mackenzie. If there are any questions.
Thank you so much, Mr. Prime Minister. There are members of the media on the Zoom link. We encourage them once again to ensure that their background is free from distraction, and of course there is no noise coming through. They are unmuting their mics, and we now have a few on for questions. First question from Althea Saunders of the Jamaica Observer.
Hi, good evening. Just a quick question, an issue that was not raised, but a concern has been brought to me. The students who are sitting the CSEC exams in July, one parent has said to me that her child has an underlying condition, and given that they're supposed to go back to the classroom prior to the sitting, for classroom contact, is there any directive for those parents?
Yeah. the minister isn't here with me today, but the standing procedure of the Ministry of Education is that if a child has an underlying condition or a special learning need, there would be provisions made to facilitate their learning and examination taking. So yes, that parent should contact the Ministry of Education, preferably the regional office, or contact the school and the education officer, and consideration and arrangements will be made. And the Minister of Health will give you a little bit more.
Just to say that the Ministry of Education has been discussing a protocol with the public health officials, which covers a very wide area, including sitting of exams. So that will be covered, Prime Minister, appropriately in that protocol.
So both from the health perspective and from the education perspective, any issues like that will be accommodated.
Thank you, Mr. Prime Minister. If I could ask just the journalists online to allow me, there are several questions on social media as well, and given that you'd started there was someone who had asked, what about daycares? With the work-from-home order not being reinstated, will the government be looking to open daycares or preschools?
Right, so the orders still remain as it relates to schools, and that would also incorporate daycares. We will have to have a special consideration, and I believe that those issues would be considered or being considered now under the protocols for the return to work. And one of the reasons why we give notice, and we didn't just on the 31st of May say we're not renewing, is to give the public the chance to raise these issues, and we are contemplating them. So I would say that the next time I'm at this podium giving my press conference, that I will have something definitive to say about how we will treat with daycare facilities.
Thank you so much, Prime Minister. Let's go then to our journalists. 18 Degrees North, Zara Burton.
Good night, Prime Minister. Over the weekend, you tweeted that you were enjoying the clash of the two veterans, Beanie and Bounty, and most people would agree with you it was a lot of fun to watch. However, were you happy with the level of social distancing at the clash? And is that the new standard for all of us? Will this be the standard for tourists? If you are not happy with it, why didn't you say something? That's one quick question. And then the other question I'd like to ask is about to the Minister, of National Security, if he is there.
Yes, Minister Chang is here.
Okay, so Minister Chang, I had put in an access to information request to PICA regarding the number of people that were admitted into the country during the lockdown period on incoming passengers without exemptions from you. I've received similar data in the past from PICA. However, in this instance, even though I'm just requesting the numbers, they're claiming an exemption clause based on national security, international relations, and defense issues. Again, since I'm only requesting the numbers of the people admitted, can I understand why those exemptions are being used on national security, defense, and also international relations? And if there's no logical excuse, can I be assured that the Minister of National Security will allow the release of the information by this week? Because PICA does have the information on the numbers.
Thank you, Ms. Burton.
On the entertainment question, I don't think you could use the virtual clash as a measure of what the protocols would be in tourism. The clash was done in good spirit, and all Jamaicans, including the JCF, played their part in pulling off one of the most successful virtual dance hall ever. So, you know, if we were to be, brutally honest, certainly not at all times social distance was observed during the performances. But from my recollection, that the gathering orders were generally observed, and at points in time, I recall they were apart, and wore masks. So sometimes, we're not going to be always successful and overly strict in what we're doing. I think in general, how it was done, the risks were mitigated, and I think that is the important thing to observe. And I was particularly pleased because a challenge that we will face, I think the bigger issue is how do we treat with the entertainment industry, because they have been badly hit in all of this. And we have to kind of bend our minds to see how we can develop and support that industry. Minister Chang, if you want to respond.
Thank you, Prime Minister. I'm not sure exactly what is required, but under the various orders that were initiated during the time of the border closure, the Ministry of National Security was given the right to make exception under special circumstances. The various criteria given can be outlined, and in particular for diplomats, it was clearly stated that we would allow our diplomats and their families who are assigned to Jamaica in particular on important issues to come in on request. That happened for the U.S. Ambassador, a number of others. I don't have all the data. I'll certainly look at that, but that was the criteria was made public here, and they were applied in the case that were for exemption. And I assume you're referring to international exemption, the border closure.
Thank you. Our next question comes from Dion Jackson Miller, RJR.
Thank you so much. Last week, Mr. Prime Minister, you spoke about the use of geofencing and the protocol that if it's used, that personal data would not be kept, suggesting that that's a policy position of the government. What, though, is the statutory authority under which you would be using geofencing? And if you are going to be operating on the statute, where are the regulations that would be needed? My other question relates to the relaxation of restrictions. At this stage, it seems that people over 65 are at home with no end in sight. I understand the vulnerabilities, but at what stage is the Ministry of Health going to feel comfortable removing the stay-at-home order for the over 65 group? And finally, does the number still remain in terms of no more than 10 people being allowed to congregate at a funeral or church or anywhere?
I'm going to ask the CMO to join, and then I'm going to ask the Attorney General to come and give you an answer, since you've raised a legal question and you being an attorney yourself. I'm not the appropriate person to respond. AG?
Thank you, Prime Minister. The geofencing that is being used is part of the measure to contain and monitor movement as part of the control of the disease. We do not have any specific legislation, but it is permitted within the terms of the Disaster Risk Management Act. And if you look specifically at Section 26, and then you go to Section 52, which is the offense-creating section, you would see that it can be done. As we go forward, however, we will be looking at specific legislation where technology is utilized. And you know that what is being done is specifically related to the containment of the disease, and it is limited in time.
So, AG, you're saying that there is a measure under the Disaster Risk Management Act which would specify how it is done, and then the penalty would flow from that.
I'm saying, Prime Minister, that the parameters of the Disaster Risk Management Act permit for the monitoring of movement in order to contain the spread of a disease. And that is what is being done with the geofencing. Persons have to be monitored. Their movements are critical because they will contaminate others and they will infect persons. And so part of how we are managing it is to ensure that we know where persons are, persons who are at risk of being contaminated and also of contaminating others.
And then the other question, CMO, will there be any end in sight for those 65 and all? I had a conversation with my father, who is obviously over 65, and he was one who was saying, you can't tell me to stay at home. And recently he told me, well, you know, I'm just going out once and then run back in. So the message has gotten home. And many persons now are, even without government enforcement, they understand that they are at risk and they are following the orders.
Yes, good evening. Like several other countries at this time, Jamaica is at a very critical point where, as we start to welcome back our returning residents, we face new risk. And so at this time, there's a particular emphasis on personal responsibility and protection of the vulnerable in our population, which includes the elderly. So at this time, it is really very difficult to say when we would be lifting that restriction on the elderly person, because it is so important at this time that as more persons come into the population and there is that increased risk of more spread of the virus, that we protect the persons who would have more severe illnesses. And that applies to this population.
Just bear in mind, however, that all the measures have a timeline associated with them. Many of them will expire at the end of this month, and then we will do an assessment and determine whether or not they should be renewed.
Sir, there was a question as well concerning the numbers for funerals, weddings. There was not the specification of weddings in the question, but a number of persons online are also asking if weddings could be extended to 15 or more.
Okay, the original order for funerals was 10, but as I explained at the last press briefing, following discussions with the trade, that is the Undertakers Association and representatives of the clergy, that it was, they recommended 10 mourners and 5 persons, including the Minister of Religion and those who would facilitate the burial of the person. So it is actually 15. And as the Prime Minister said, at the end of this order, it will be reviewed. But let me say that there are persons who are operating outside of what is placed in the order, and we would advise persons please to cooperate, because whatever actions are taken that does not conform with the order will jeopardize whatever consideration will be given when the order is to be reviewed.
You might also recall that for churches, we had made a new order which saw the implementation of a physical distancing rule, which effectively was a square footage per person rule, which allowed for more than the 10 within the space deemed as the worship area. For weddings, we had not made any special provisions, but we will revise those when we renew the order in a few days' time. So there might be some relaxation there to get more Jamaicans having their weddings with their family and loved ones, being able to observe and be there. And I don't think anybody would complain about social distancing between a bride and a groom.
Thank you so much, Prime Minister. We'll take 2 more questions. Dashan Hendricks from TVJ, and he'll be followed by Damian Mitchell, and then we'll close. Dashan? Dashan, are you hearing us?
Yes, you're hearing me?
Yes, go ahead, please.
Okay, Mr. Prime Minister, just looking down the road to September when school reopens, has a consideration being, are considerations being made now in terms of budgetary allocation to fix schools to allow for the physical distancing that will be required going forward in the new reality of COVID-19? I mean, some classrooms have like 40 students, and if we're going to be doing 2 meters apart, if indeed that's what we're going to be doing, then we'll be seeing classrooms of 10. Will we be building new classrooms? Will we be going back to the shift system as being suggested? Just outline for me, what are the plans that are being made when school reopens in terms of getting the schools ready to have students in there in the reality that we have COVID-19 and have to live with it?
You know, Deshaun, that question is a very important question because it exposes the disconnect between what the public expects to be the government's response and what the government's abilities actually are. And the government's ability is not unconnected to what the public actually does. So there is an expectation that we would have class sizes cut in half, which would mean that we would have to build more schools, which would mean that we would have to get more taxes, more revenues coming in. But how do we do this if we keep the economy locked down? How do we solve the pandemic public health issues without at the same time solving the economic issues? And those who would seek to create a divide between the two are disingenuous. Both things have to be done together. We have to work smarter and we have to work safer. The strategy of the government has been to control the disease within our resources, and we started off with those measures, those public health measures, so that we don't have a crisis immediately of resources. And then to get public buy-in, public cooperation through a public education campaign and a confidence building campaign, so that the citizen, the individual, is faithful in following the orders and acting responsibly. And once that becomes the routine reaction of our citizens, then that gives you more space, as it were, to develop your economic response. And as you develop your economic response, that means once the public is fully aware, once they are fully seized of the protocols, once they are going to be acting responsibly, then they can go back to productive activities, which will return revenues to the government, which the government can then use to make the capital works and other recurrent expenditure needed to ensure that we stay on top of the pandemic issues. So it is all connected, Dashan, all connected. So I'm not going to tell you today that we are going to be building more classrooms. What I'm going to tell you is that we want to have a very strong public education campaign, including for our children. What I can tell you is that we will be increasing the level of monitoring and surveillance of schools. What I can tell you is that we will be increasing, and Minister has spoken to it, Minister Tufton has spoken to it, that we'll be increasing the number of public, what's the term you call them, the community health aides, that will be there in the communities to assist with the monitoring and the surveillance and the public education. Because that, more than anything else, is the key. Bear in mind, you could double your school space, and one irresponsible behavior could still cause an outbreak. So the critical thing is how we as a people, or we as citizens, or we as individuals, how we will act. If the government were to open the beaches tomorrow, would we see a flood of people going there, ignoring social distance, ignoring all the other requirements? If we open the bars as we did, would we see the bar owners and the bar users not following the protocols? It all depends. So your report, Minister, suggests that there is general compliance, so that means we can move in a measured way in returning the economy. And that's what it comes down to. If our people are responsible, we can move with greater speed and alacrity in ensuring that you get back your job, that you're not laid off. That's what it comes down to. So I can't tell you, Dashan, that there will be any doubling of the budget to building new schools. But I can tell you that we will be putting in place the infection control and prevention measures, the public education measures, and the surveillance measures to ensure that we can go back to school in a safe environment.
Thank you, sir. A final question, Damon Mitchell, the Gleaner Company.
Thank you so very much, Prime Minister. You mentioned earlier that we'll be having 40 deportees coming in another week. Can you say where they're coming from? That's question one. And I have to go back to this question because it was not answered when the Education Minister, or the Minister with responsibility for education, was at the last press briefing. That is, given the current issues with the distance learning program, can the government explain the policy for end-of-year assessment of students?
So let me start with the end-of-year assessment. Minister Samuda, when he was here last, went through a very detailed presentation. Oh, you didn't think it was detailed enough? Turn on your mic.
End-of-year assessment. I'm sorry. Are you hearing me, Prime Minister?
I'm hearing you now.
Yes, I'm saying the minister did not address the issue of end-of-year assessment. He was speaking to PEP and to CSEC. That was not the question. The question is for students who are now doing Zoom classes, etc. What's the policy for their assessment for the end of this year?
All right. My recollection is that he had spoken at length, but what I will do is I will ensure that when we speak at the next press conference, that question will be specifically dealt with. Your other question was the
deportees.
No, I said the involuntarily returned persons. Yes, my understanding is that Minister Chang, these are from the United States. Yes, they are from the United States. So I think we have had a good press conference. We have under hour and 30 minutes. So just to be quick in closing, the government is doing, Jamaica is doing fairly well in managing the epidemic. We are now focusing on ensuring that we can minimize the effects of the recession. The space created by the good management of the epidemic must not be wasted by complacency or any irresponsible behavior on the part of the citizens. Two things work hand in hand. So let us continue to manage the epidemic well. That gives us space to open up the economy some more, to return to full productive capacity as quickly as we can, and we will survive both the epidemic and the recession. Thank you.
Thank you so much, Mr. Prime Minister. And there ends our briefing for this evening. Do recall that the curfew hours have now been amended to begin at 9 p.m. So we wish you all a safe evening, and we will certainly be back sometime in the future for another briefing. Good evening.
Hi there, I'm Simon Preston from TVJ. Thank you very much for watching our YouTube channel. To see our latest videos and also to see live events, click here. To see our full videos on onespotmedia.com, click here. Thank you very much.
COVID-19 tip. Protect yourself and others from getting sick by washing your hands after coughing or sneezing when caring for the